Hello, my name is Sydney Cohen, and today I will be talking to you about smoking. Today my audience is my dad, my brother, my grandpa, my grandma. How do you plan to live your life? Long and healthy or short and reckless? How do you think your decisions affect the people that love and care about you? About more than 480,000 deaths happen per year due to cigarette smoking. No matter how you smoke it, tobacco is very dangerous to your health. There's no safe substance. These substances that you inhale don't just affect your lungs, but your entire body. Smoking can lead to many short-term and long-term complications in your body, which can lead to a variety of problems. Smoking does not just impact you internally, but externally as well. Three main systems that keep your body together and healthy are the central nervous system, the digestive system, the integumentary system. The way you act, live your life, and your appearance all can change due to the decision to smoke. The first system I will be talking about today is the central nervous system. This consists of two parts, the brain and the spinal cord, which controls most of the functions of the body and mind. The brain is the center of our thoughts and has the control over our body movements. By making decisions to smoke, affects the central nervous system in a harmful way. The first negative impact the central nervous system causes is behavioral augmentation. You can develop anxiety, depression, and it can have a long-term effect with cognition. Starting with anxiety, this can be explained through the effect of GABA. A neurotransmitter is most responsible for the lack of anxiety and the state of wellness, as smoking gives GABA the opposite effect, causing anxiety. Nicotine also has a negative impact on dopamine and serotonin, which are two more transmitters associated with depression and mental health. Depression mostly begins when smokers go through withdrawal and become dependent on nicotine. A longer-term effect that smoking has is the impact of cognitive abilities. Boyd Bergenstein said that in August 2007 issue of Neuropsychology Review, Dr. Gary Swan and his associates found that smoking was significantly associated with brain matter degeneration and cellular death, cognitive decline over repeated measures, and dementia, which is a disorder that is marked by memory loss, personality changes, and impaired reasoning. Following brain augmentation comes the effects that nicotine has on the body. When the smoke with nicotine or tar gets to your lungs, the nicotine is absorbed in a matter of seconds. In every cigarette, smokers get about 1 milligram of nicotine in their body. The effects of nicotine include an increase in blood pressure and heart rate. An area in the brain called the adrenal medulla is what nicotine binds to, which increases the flow of adrenaline. This is what causes the increase in blood pressure and heart rate, which can cause pressure problems. Moving on to respiration, tobacco causes irritation on the voice box, causing smokers' voices to become raspy. Lung airways can become tightened due to swelling, which causes trouble breathing. You will start to realize you have trouble with your respiration when you have symptoms, such as coughing and wheezing, but moving on to something more permanent is damage to your air sacs, which is called emphysema. Permanent inflammation of your breathing tubes, which is called chronic bronchitis and lung cancer. Smoking affects your central nervous system in a very impactful way, and your body will begin to decay and decrease in healthiness by realizing the changes in your body, blood pressure and heart rate, and respiration. Following the central nervous system comes the digestive system. The digestive system is made up of the digestive tract, which includes the liver, pancreas, and gallbladder. As food enters, it follows the GI tract and passes through the organs. The liver, pancreas, and gallbladders are the organs of the digestive system. The digestive system helps the body get the nutrients it needs by breaking down the food. These nutrients are used for energy, growth, and cell repair. The first negative effect that smoking has on the digestive system is the increase of heartburn and gastroesophageal reflux disease. Heartburn is a burning pain in the chest caused by reflux. Smoking weakens the lower area of the esophagus, which causes an increase of heartburn, which can in the long run damage the lining of the esophagus. Gastroesophageal is the same as heartburn, but occurs more than twice a week. This can lead to more serious health problems, like for example, bleeding ulcers in the esophagus. Another part of the digestive system that affects smokers is Crohn's disease. This is an inflammatory bowel disease that causes problems in the GI tract. It will start with people having pain and diarrhea, but can lead to more complications such as blockages of the intestines and ulcers. The more you smoke, the more likely you will have more severe symptoms, more complications, higher need for medication, more likely to get surgery, and worst of all, after the procedure is done, you can get the symptoms all over again. One last major issue that comes with the digestive system from the effects of smoking is insulin resistance. This can put you in risk of type 2 diabetes, which develops faster than those who don't smoke. Type 2 diabetes is a lifelong disease in which there is a high level of sugar in the blood. When you have type 2 diabetes, your fat, liver, and muscle cells, which are part of the digestive system, do not respond to insulin the right way. This is called insulin resistance. This is not healthy and can lead to other health problems in the future. Overall, the digestive system is very important because it gives your body the nutrients it needs. From smoking and having heartburn and gastroesophageal reflux, Crohn's disease, and insulin resistance, you will have negative impacts on your digestive system, which will cause major problems for your body in the future. The last system that we will be talking about today that is strongly affected by your appearance and the way other people perceive you is the integumentary system. Starting with skin changes, your skin can become leathery and deep wrinkly looking. According to the American Academy of Dermatology, smoking leads to biochemical changes in the body that speed the aging process. Moving to your mouth, smoking may give you foul breath, raise your risk of getting oral cancer, but appearance-wise causes coloration of the teeth. It is not a good look and won't look attractive to others. The most impactful side effect of the integumentary system is your odor. The smell of a cigarette can linger in the lungs. Long-term, the chemicals in tobacco smoke can remain in the mouth and can lead to a secondary cause of bad breath. By smoking just once, the smell can linger onto your clothing, creating a heavier smell for the people around you. No one likes to be around smelly people. Smelling like an ashtray isn't the only impact smoking has on the nose. Smokers also experience a dulling of their own senses. They can't appreciate the taste of foods or even know when they start to smell bad themselves. Overall, whether it is your skin, mouth and gums, or odor, the integumentary system is greatly affected by smoking and can make a big impact on your appearance to others. Living life to the fullest is a motto that many people live by, but that also includes keeping your body healthy, which is the opposite effect of what smoking will give you. Your central nervous system will begin to shut down and change due to behavioral augmentation, rapid effects of nicotine and respiration. Your body needs food and drinking fluids, but from the impact smoking has on the digestive system will cause heartburn and gastroesophageal reflux, Crohn's disease, and insulin resistance. And lastly, your appearance to others will change due to your integumentary system, which includes your skin and hair, mouth, gums, and teeth, and odor. The decision to smoke affects all three of these major systems, which will affect the way your life continues. Once you start to smoke, it is not easy to stop. Some people find it impossible due to the nicotine their body is now immune to. There are other ways to go than to give up. Make a plan. There are many different ways to quit smoking, and the best plan is the one you can stick with. Some examples are cold turkey, behavioral therapy, nicotine replacement therapy, medication, and combo treatment. The people that surround you all want the best for you, so tell your friends and family, and they will support you and give you that motivation when you start to lose confidence in yourself. Quitting will be the best thing you ever do for yourself, but you have to stick with your plan.